Hi, I am Dr. Jocelyn. Today is our special topic, and I want you to listen to my words very carefully because what you are about to hear could protect your health, your independence, and even your life as you grow older. We are going to have one of the most important, and yes, one of the most controversial conversations in senior health. It is about three medical tests that many doctors insist are mandatory after the age of 70. You are often told that if you refuse them, you are being irresponsible or careless with your health. But the medical evidence is increasingly showing something very different. For many healthy seniors, these tests can cause more harm than good. It is time to bring this information into the open, not with fear, not with anger, but with science, clarity, and respect for your life and your choices. These tests generate billions of dollars every year. And because of that, the risks are rarely explained honestly. Yet when we understand what the research truly says about routine screening in people over 70, we do not just avoid unnecessary procedures. We avoid serious complications. We preserve quality of life. And we focus on what actually helps you live better and longer. This is a space where patient centered medicine comes first, where your well being matters more than automatic protocols. Whether you are approaching 70, already past it, or caring for aging parents, this information can literally save a life, maybe your own or someone you deeply love. Here is the uncomfortable truth I have seen again and again over decades of working with older adults. There are three tests that doctors routinely order for people over 70, calling them essential for preventive care. Yet major medical organizations have quietly changed their recommendations. They now acknowledge that these tests often lead to overdiagnosis, overtreatment, and serious complications in seniors who might have lived longer, healthier lives if they had never been tested at all. Let me describe a situation that happens every week. A patient says, "Doctor, I am 73. I feel great. I am active. I have no symptoms, but my doctor insists I need a colonoscopy, aggressive cancer screening, and heart stress testing because these are mandatory at my age. I have heard stories of seniors having complications from these procedures. I feel fine. Do I really need them? Or is there something I am not being told about the risks versus the benefits at my age?" This question comes from healthy seniors who sense that something feels wrong when aggressive testing is pushed on them despite feeling well. It comes from families trying to protect their parents from unnecessary medical harm, and it reflects a growing awareness that more medical care is not always better care, especially after 70. I want you to stay with me because by the end of this message, you will have information that can protect you from procedures that evidence increasingly shows cause more harm than benefit in healthy seniors. Avoiding what you never needed can add years of quality life. Here is a reality few people explain honestly. Screening tests are designed for populations where benefits clearly outweigh risks, but after 70, that balance changes. Life expectancy changes, diseases grow more slowly, and the body becomes less tolerant of invasive procedures. Protocols designed for 50-year-olds can be actively harmful when applied to healthy 75-year-olds. Yet many tests are still ordered automatically, without real discussion about whether they will truly help you live longer or better. So, we will answer four questions together. What are the three tests routinely pushed after 70? Why does evidence now question their value in healthy seniors? What are the real risks that are often minimized? And how can you speak with your doctor in an informed way and decide whether refusing a test may actually be the healthier choice for you? Let us begin with the three tests that most healthy seniors over 70 should seriously think twice about. The first test that most healthy seniors over 70 should seriously consider refusing is routine colonoscopy screening after the age of 75. This is the test that causes the most complications in older adults while offering very little real benefit. Major medical organizations now openly recommend against routine colonoscopy after 75 for people who had normal screenings in the past. Yet many doctors still push it. Why? Because colonoscopy is extremely profitable. Each procedure can generate thousands of dollars for the medical system. There is a powerful financial incentive to keep older adults on this testing treadmill, even when the evidence says it is no longer helping them. What is rarely explained to you are the hidden risks. After 70, the chance of serious complications rises sharply. Bowel perforation becomes much more common. What might be a 1 in 1,000 risk for younger adults becomes several times higher for seniors, often requiring emergency surgery. Sedation increases the risk of heart rhythm problems and breathing issues. Even the bowel preparation can be dangerous, causing dehydration and electrolyte imbalances that lead to falls, confusion, or heart problems. Large, long-term studies following tens of thousands of seniors show something very important. Older adults who continued routine colonoscopy after 75 did not live longer and did not die less often from colon cancer than those who stopped. What did increase was hospitalization from complications caused by the test itself. Colon cancer usually grows very slowly. If you are 75 and had a normal colonoscopy 10 years ago, any new polyp is likely to take another 10 to 15 years to become dangerous. Statistically, you are far more likely to pass from heart disease, stroke, or other natural causes before that slow-growing polyp ever threatens your life. Meanwhile, the colonoscopy carries immediate and very real risks today. There is an important exception. If you have symptoms such as bleeding, unexplained weight loss, or major changes in bowel habits, a diagnostic colonoscopy may be appropriate. But routine screening when you feel well is what evidence increasingly argues against after 75. The second test is aggressive prostate cancer screening with PSA blood tests after 70. This may be the most emotionally charged of all because the word cancer creates fear. PSA testing is quick and easy, and it opens the door to biopsies, surgeries, and radiation treatments that generate massive follow-up revenue. So it is often ordered automatically, without discussion. Here's the truth most men are never told. Most men over 70 already have some prostate cancer cells. Autopsy studies show that well over half of men who die of other causes had prostate cancer they never knew about. It was growing so slowly that it never caused harm. Large international studies following hundreds of thousands of men show that for those over 70, PSA screening does not reduce death from prostate cancer. What it does increase is biopsies, surgeries, and radiation, all with serious side effects like incontinence and sexual dysfunction. Once a PSA is elevated, you are pushed toward biopsy. That biopsy carries a real risk of serious infection, higher in older men. If cancer is found, which is very likely, you are then pressured into treatment, even when the cancer would never have affected your remaining years. I have seen healthy 75-year-old men who felt wonderful, had a PSA test, were diagnosed, treated, and ended up with permanent urinary and sexual problems, all to treat a cancer that would never have threatened their lives. That is why major medical groups now recommend against routine PSA screening after 70 unless there are strong risk factors or symptoms. In the next part, we will talk about the third test and how one abnormal result can start a dangerous chain reaction that changes a healthy life forever. The third test that is routinely pushed on healthy seniors is aggressive cardiac stress testing, when you have no symptoms at all. No chest pain, no shortness of breath, no unusual fatigue. You feel fine. Yet you are told, at your age, we need to check your heart just to be safe. It sounds reasonable. It sounds responsible. But in healthy seniors, this test often opens the door to a chain of events that creates harm where none existed. Stress tests are highly profitable. An abnormal result almost always leads to more procedures, heart catheterizations, stents, even bypass surgery. These interventions generate enormous revenue. Because of that, stress testing has become routine, even when there are no warning signs. What is rarely explained is that stress testing itself can be dangerous in older adults. The test literally pushes your heart to its limit. In seniors, it can trigger irregular rhythms or even heart attacks. False positive results are extremely common. In older adults, nearly half of abnormal stress tests show nothing dangerous when followed by invasive testing. But once that first test looks abnormal, the medical system moves quickly. You are sent for a catheterization. A small blockage is found, something that would never have caused a problem in your lifetime. Then comes the words, "Let's fix it to be safe." A stent is placed. You are put on blood thinners for life. Now you live with a higher risk of bleeding, bruising, falls, and hospitalizations, all because of a screening test you never needed. Large studies following thousands of symptom-free seniors show that those who undergo routine stress testing do not live longer and do not have fewer heart attacks than those who do not. What they do have is a much higher rate of complications from the procedures that follow those tests. This is how the cascade begins. You are 73. You feel well. You get a stress test, just to check. Something small appears abnormal. You are rushed into more testing. A mild blockage is found. A stent is placed. Medications are added. Side effects appear. Your life changes. Not because you were sick, but because you were screened. This does not mean heart testing is never appropriate. If you have chest pain, breathlessness, sudden weakness, or unusual fatigue, these tests can be life-saving. But using them to search for problems in healthy, symptom-free seniors often creates disease instead of preventing it. Let me tell you about a patient I will never forget. Margaret came to me at 76. She was active, independent, full of energy. Her previous doctor had scheduled her for a colonoscopy, heart stress testing, and aggressive screening, calling them mandatory. We sat down together. I showed her and her husband what the evidence actually says for people their age with no symptoms and normal past results. We talked about how these tests were more likely to find issues that would lead to risky treatments than to truly extend their lives. They chose to refuse all three. Instead, they focused on what truly supports healthy aging: daily walking, strength training twice a week, a simple, balanced diet, social connection, managing blood pressure and cholesterol, sleeping well, living fully. 5 years later, Margaret is 81 and thriving. During that same time, three of her friends followed the standard path. One was hospitalized after a colonoscopy complication. One's husband lost bladder control after prostate treatment. One is now on lifelong blood thinners after a stent he never truly needed. This pattern is not rare. I have seen it hundreds of times. Healthy seniors who decline aggressive screening often live longer, more comfortable, more independent lives than those who submit to every test. The goal after 70 is not to find every possible abnormality. It is to preserve function, dignity, comfort, and joy. And sometimes, the healthiest choice is knowing when to say no. The evidence supporting this approach is strong. Large analyses show that for seniors over 75 who have no symptoms and had normal past screenings, routine colonoscopy, PSA testing, and cardiac screening do not reduce death rates. What they do increase is harm: hospitalizations, infections, surgical complications, loss of independence, fear, pain. The Choosing Wisely campaign, supported by dozens of respected medical organizations, clearly advises against these tests in symptom-free older adults. They describe them as low-value care that wastes resources and, more importantly, harms patients. Even international comparisons tell the same story. Countries that screen seniors less aggressively often have outcomes equal to or better than those in systems that test everything. More testing does not mean more life. Before agreeing to any screening test after 70, ask your doctor a few simple questions. Given my age and health, what is the real chance this test will find something that would actually threaten my life? What are the exact risks of this test and the procedures it may lead to? If something is found, what would we truly do differently? And would that change improve my quality or length of life? What do major medical organizations recommend for people my age? These questions shift the conversation from fear to clarity. My guidance for healthy seniors is this: put your energy into what truly improves longevity. Walk every day, build strength, eat simply, stay connected, manage known conditions, sleep well, live fully. This does not mean ignoring symptoms or avoiding care. It means being selective. It means choosing wisdom over reflex. After 70, less aggressive medicine often leads to longer, healthier, more comfortable lives. Healthy aging is not about chasing every possible disease. It is about protecting the life you already have. Sometimes the bravest and healthiest choice is knowing when to say, no, this is not right for me.